Welcome to our second video in a series of 5 videos looking at the new Pharmacy Contraceptive Service, helping contractors in Nottinghamshire prepare for and deliver the new service. The videos are about getting your pharmacy ready for the contraceptive service, this video. There will be another video getting your team ready for the contraceptive service, and then 2 videos on delivering the service effectively. My name's Liam Stapleton. I support the LPC with training initiatives.
And I'm Mike Jones. I'm the Service Implementation Lead for Nottinghamshire LPC.
There are some resources that go with our videos, available as PDF files that accompany the video and will be useful for you to have as you watch the video. If you haven't printed these off yet, pause the video and print them. There's an action plan that you can take notes of actions that you need to undertake as you watch the video. What we intend to cover in this video is identifying the local need for the service, discussing the service with local practices and stakeholders, setting up your processes, ensuring you have the right equipment, and briefing your staff. But first, it'd be good to define what the service is. Tier 1 is continuing oral contraceptive treatment that's already been initiated for appropriate patients using a PGD. Tier 2, which will start later this year, will allow initiation of oral contraceptive treatment for appropriate patients, again using a PGD.
But you might be asking yourself, so why is this service important to my pharmacy? Well, let's just consider a few points for you to think about. First of all, what's the local need? Will there be sufficient volume to justify you operating this service? How often will you need to deliver the service and to make it worthwhile and maintain your competence? So how can we assess the local need? Well, firstly, what contraceptive services are already available locally? What are the GPs doing locally and how engaged are they in sexual health services? It's worth considering as well what the level of deprivation is within your ward, because one of the principal goals of the NHS is to reduce health inequalities. And lastly, what's the rate of teenage pregnancies in your ward? Another important consideration. All this information is important to think about because you will need to help yourself prioritize this service along with other services that you're currently offering.
Once you understand the potential benefit of the service to your pharmacy, patients, the local community and the local NHS, it's important to engage with local stakeholders, local GP practices and other contraceptive services in the area. It's important to manage stakeholders effectively so you're collaborating with rather than competing with other local services. Understand what local pathways are. Agree important areas where you'll interact. How will the service meet local needs and integrate into local services? How will you keep the practices informed of patients provided with contraceptives? Who will you refer? And how will the referrals be made effectively? While getting support from stakeholders, it's also important to set up the processes needed to deliver a safe, effective, and efficient service.
So let's take a look at some of those processes we'd recommend you set up. Firstly, creating a great record system for the service in Farm Outcomes and Sedgedom, who provide IT tools to record information for this service. Other record systems are available both digitally and manually, and they are acceptable, but you will need to collect the appropriate data listed in the service specification. Secondly, if you haven't done so already, you'll benefit from implementing an appointment system, so that will allow you to proactively manage the pharmacist's time and you can book in patient appointments when you're able to see them. Thirdly, how about creating a process of how you'll ensure your fees are claimed for at the end of the month? It's really important that you get paid for the work that you do. And what processes will fit with others in your pharmacy to make sure that this service is claimed for in the right way, and that reconciliation happens at the end of the month. Some IT systems may already provide that for you, and with an integration into NHS systems to allow this to be more streamlined. And lastly, please consider that the safeguarding procedures in the pharmacy have been updated to include the contraceptive service and the key issues for safeguarding associated with that. And this might include, for example, how you might manage patients who are transgender or are undergoing gender reassignment.
There is some equipment that you'll need as well to deliver the service. The first thing is the blood pressure monitor. If you're already providing the hypertension case finding service, you should have a suitable blood pressure monitor in the pharmacy already. We also need to have weighing scales and height measurement. We can ask patients for their BMI or their weight or their height. However, we need to be sure that we're getting the right data to allow us to make the right decisions. So having the weighing scales and height measurement is important in the pharmacy. We also need a tape measure for waist measurement as well. So having one of those available. And finally, we need to make sure we've got a good range of information resources that can be given to the patient, whether they're getting the oral contraceptive service from us, or we find that they're not suitable for the contraceptive service and we need to refer them. Making sure they've got good contraceptive practices whilst they wait to get an appointment with an appropriate person.
So how do you actually register for the service? Well, you register using the MYS portal. It's important to understand as well that when you register, the assumption is that your pharmacy is ready and able to offer that service from that point. There's a setup payment of £400 plus £250 for the first 5 consultations and a further £250 once you've completed 10 consultations.
So the next thing really to do is think about briefing all members of the team. Whilst the pharmacist needs to provide the service, there are other people in the team who will support, from people on the counter to who will be the first people to greet a patient, to technicians who might take blood pressure, and we need to explain how the service works and the individual roles people will have in the service. We'll provide more information about this briefing in the next video, getting your team ready for the contraceptive service. In this, we'll also talk about the training requirements for pharmacists and other members of the pharmacy team. So what are you going to do now? Review the action plan you've already started to complete. Add in any other action points you may have missed. And remember to assign deadlines and owners to these tasks. Look out for the next video. It'll be available on the LPC's website and announced on our social media as well, Twitter, LinkedIn and Facebook.